Hello guys, welcome to BMS with me. Today let's learn about the topic gestational diabetes. Diabetes mellitus in pregnancy. Diabetes mellitus is a chronic metabolic disorder due to either insulin deficiency or due to peripheral tissue resistance to the action of insulin. The ultimate effect is hyperglycemia. Now coming to types of diabetes mellitus. There are two types of diabetes mellitus, that is type 1 insulin dependent diabetes mellitus and type 2, that is non-insulin dependent diabetes mellitus. Coming to type 1, that is insulin dependent diabetes mellitus. It is characterized by young age onset, that is during juvenile period, and absolute insulopenia. They have genetic predisposition with the presence of autoantibodies. Now coming to type 2 non-insulin dependent diabetes mellitus. It is characterized by late age onset, overweight women, and peripheral tissue like skeletal muscles, liver, etc. Insulin resistance. Now, about 1 to 4% of all pregnancies are complicated by diabetes mellitus, and 90% of them are gestational diabetes mellitus. Nearly 50% of women with gestational diabetes mellitus will become overt diabetes, that is type 2, over a period of 5 to 20 years. Now coming to gestational diabetes mellitus, it includes cases with abnormal carbohydrate tolerance with onset or first detected during the present pregnancy. The entity usually presents late in the second or during the third trimester. What are the potential candidates of gestational diabetes mellitus? Like who are more prone to gestational diabetes? That is, first one is positive family history of diabetes like parents or siblings. Family history should include uncles, aunts, and parents. Second is having a previous birth of an overweight baby of 4 kg or more. Third is previous stillbirth with pancreatic islet hyperplasia revealed on autopsy. Fourth one is unexplained perinatal loss. Fifth is presence of polyhydramnios or recurrent vaginal candidiasis is present pregnancy. Or sixth is over age of 30 years. Seventh one is obesity. These are the potential candidates of gestational diabetic management. Women with good glycemic control and who do not require insulin may wait for spontaneous onset of labor. However, elective delivery, induction, or cesarean section is considered in parents requiring insulin or without. What are the effects of diabetes on pregnancy? Complications of diabetes. It is divided like for maternal complications and fetal complications. Maternal, during pregnancy, abortion, first one. It is unrelated to controlled diabetes, but recurrent spontaneous abortion may be associated with uncontrolled diabetes. Second is preterm labor. Almost 20% may be due to infection or polyhydramnios. Third is infection occurs more often, especially that is urinary tract infections. Then there is increased incidence of preeclampsia, almost in 25%. It is associated even in the absence of vascular lesion. Fifth is polyhydramnios. It is a common association. Large baby, large placenta, fetal hyperglycemia leading to polyuria, increased glucose concentration of liquor irritating the amniotic epithelium, or increased osmosis are some of the probabilities. Sixth is maternal distress, may be due to the combined effects of an oversized fetus and polyhydramnios. One is diabetic retinopathy. Hemorrhages and proliferative retinopathy are related to duration of diabetes as well as with glycemic control. Laser photocoagulation is preferred treatment here. Eighth is diabetic nephropathy, may lead to renal failure. Ninth is ketoacidosis. These are the complications seen in maternal. And during labor, what happens? There is increased incidence of prolongation of labor due to the big baby, shoulder dystocia, that is, it is a disproportionate growth with increased shoulder head ratio. Third is perineal injury. Fourth one is postpartum hemorrhage. Fifth is operative inference. Now, the management of diabetes mellitus. First is preconceptional counseling to achieve control of diabetes before the onset of pregnancy. Second is fetal congenital malformations are significantly low in women who received preconceptional counseling. Second is principles in management are careful antenatal supervision of and control of diabetes so as to maintain the glucose level near the physiological level as much as possible. Second is arrangement for the care of the newborn. Thank you.